going to switch gears. I want to talk about Obamacare. Nearly a half of ER, emergency room doctors nationwide, say they have seen more visits this year, and nearly 9 in 10 expect those visits to rise in the next 3 years. Our next guest is a founder of the Cure Urgent Care Clinic, and he says his business is booming. Here is Dr. Jake Deutsch. He's with us here in New York. Doctor, welcome to the program.
Thank you, Stuart.
Right. Cure Urgent Care. That's an urgent care facility, a chain thereof, correct?
Exactly.
So you're a partner in it?
I'm a partner and clinical director.
Seems like you're somewhat similar to the emergency room. This is what people flood into when there's something wrong with them on a short-term basis.
We are. We're an intermediary between the emergency department and primary care offices. So if you have an emergency that's not life-threatening, you come to see us as an alternative.
Now, Obamacare is pushing more people into healthcare and covered healthcare.
Absolutely.
And they are flooding into your operation.
Emergency departments. I've been an ER physician for 12 years, and I've seen definitely an influx of patients in the emergency department, overcrowding, and that's where this urgent care practice becomes so important. It gives an alternative to people having to wait in emergency departments, having to deal with the overcrowding, and being an intermediary between the emergencies and the other sort of urgent, non-life-threatening issues.
Seems to me that you are one of the few beneficiaries of Obamacare.
Well, I'm not.
You are leeching off my taxpayer dollars.
I'm one of many. This is actually a $14.5 billion business. Urgent care businesses is $14.5 billion.
Is it now?
Yeah.
And rising rapidly, I take it.
Since 2008, $2.3 billion have been invested into it. So we're talking about a big piece of the pie in medicine.
Cure Urgent Care is private.
It is private. It is a concierge level of service. So
wait, what's that? I hear this. Is that luxury?
It's better than what you would expect to see in any other type of environment. Most hospitals are overcrowded, understaffed, patients waiting for a long period of time. The people that have a broken ankle or a urinary tract infection are kind of put to the bottom of the list in terms of severity. So what we're providing is immediate care. You don't wait. You're seen by a doctor who's trained in emergency medicine, and it's in an environment that's really beautiful. It's like a spa hotel.
If I'm poor and I've got coverage through Obamacare, can I come to you?
You can.
Well, I know I can. Will you treat me?
I will absolutely treat you, but there are some limitations. If you don't have insurance, you could pay cash. If we do not accept your insurance, which is pretty small, you could also look at the benefit that most hospital visits are $800.
Do you take Medicaid?
We do not take Medicaid.
You see. You're out there helping people, but not poor people. That's shameless, doctor.
It's not shameless. It's a shift in terms of what priorities are in medicine. So,
what would you sell urgent care, Cure Urgent Care for?
What would I sell it for? Right now, nothing, because it's my passion and I'm in love with doing this job.
Everybody says the same thing.
The question.
If I give you $100 million tomorrow morning, would you take it?
Probably.
Oh, then you're an honest
man. And then we could go on vacation. But I know that these are trading for hundreds of millions of dollars, centers that have 40 and 50 locations. So it's big business. And
so you're a wealthy guy.
Not yet, but we'll see.
Yeah, you are. Dr. Jake Deutsch, Cure Urgent Care, a partner therein. Thanks for joining us, sir.
We do appreciate it.
Thanks very much.